Will artificial intelligence take care of our health, or will it take over healthcare? That is a question asked by Alexandra from the European School in Luxembourg. Artificial intelligence can reduce costs in healthcare, but it can enable more personalized treatments and free up healthcare professionals of repetitive and monotonous tasks. Good luck, Alexandra.
Thank you very much. So, as already said, today I'll present one essential question. Will AI take care of our health, or will it take over healthcare? First, I will give a short introduction with some definitions, and then I will talk about the key areas and opportunities, then about the technical challenges, then about the challenges of the non-technical nature, and after the risks and concerns. At the end, I will give a short conclusion. So, what is AI? AI is any code or algorithm that is designed to mimic human intelligence or behavior. It already exists in our world today. For example, Siri is based on AI, or personalized reading recommendations or shopping recommendations are based on AI. Healthcare is public or private organized provisions of medical care. So, what are the key areas and opportunities of AI? So, already now, AI is mostly used for claims processing and patient administration. However, it has much more potential. It can be used to prevent medical errors. For example, it can do a right diagnosis by processing large amounts of data, and then doctors could just enter symptoms and the AI would make a proposition for a diagnosis. It would also provide a more efficient treatment, as it could search for similarities between different patients. It is also a very good means of medical image recognition, and already now AI is better in radiology than many doctors. It is also very good in drug discovery and repurposing, because it can crack the relationship between a molecule, like for example a drug, and a receptor in the body. What are the technical challenges of AI? Of course, AI has many technical challenges. It needs large amounts of high quality and structured data, which is difficult to get. Of course, it also needs this large amounts of data, and it has to get this data from heterogeneous sources to get enough. For example, medical images or EHRs. It's probably going to be done from different repositories, and you always have to ask, is the data interoperable? Also, the data security and anonymization is a very important question, especially in Europe. In the EU, there is the GDPR framework, so the General Data Protection Regulation, and it's giving high standards for personal data protection. Of course, for secondary use, the data must be anonymized or pseudo-anonymized. What are the challenges of the non-technical nature? So first of all, there are regulatory challenges again. Of course, there are already national structures, for example, FinData in Finland or the French Data Hub in France, but many member states do not have a database yet. Then GDPR, of course, slows down the research because it needs to develop AI, we need enough data, and it is difficult to get personal healthcare data. Then there are the ethical guidelines. For example, doctors, it is difficult for them to trust AI. And this is also because they do not know where the result comes from. And that is why it is more important to make AI more explainable. This is the so-called black box phenomenon, that we don't understand where the AI got the conclusion from. Also, there's the question, a very big question of liability. You probably know the most important, the most easy example is the one with the self-driving car. Who will be reliable in the end? And here it is also this question. Here we can see a short comic. We can see that that when radiology is handed over to artificial intelligence, the computer finds, the AI makes an error, a misdiagnosis, and the workforce said, sorry, but you got the job and it's your job now. And this leads us to the next problem. Many people think that AI will take away all jobs in the long run. However, this concern is not really necessary because AI only takes over narrow and repetitive tasks. So it's not able to do human-level intelligence. This is the so-called Moravec paradox because it says that AI finds difficult things easy, but easy things difficult. For example, it could not be able to play bricks, but like a 2-year-old child, but it's able to win against world champions in chess. AI should therefore work side by side with physicians to get them best results. Therefore, the training for physicians must be adapted, the curricula must be adapted, and then this would also improve the acceptance and trust in society, and also the acceptance of trust of medical doctors to AI. In the end, AI will not take over our healthcare, but they can reduce human contact. There's an example in Singapore where right now in COVID-19 times the thermal cameras are used to reduce human contact. And it would mean that it takes over those repetitive and standardized and monotonous tasks. It is also very efficient in processing large amounts of data, and it helps physicians in decisions. Thank you very much for your attention.